The Trifix large locking plate and screw system provides multiple options and configurations for various fixation solutions in lower large bones. Each plate features various hole types, tailored to its specific location and function. An imprinted line on the plate delineates two areas, facilitating easy identification of screws. The dynamic compression hole, DCP hole, allows for the insertion of a cortical screw, offering additional compression as needed. Among its offerings is the distal tibia locking plate, Medial, one of 5 distinct plate types in the system. Typically, this procedure is conducted with the patient in a supine position. Use X-ray imaging to adjust fracture fragments and to determine the appropriate size and type of the distal tibia locking plate, Medial. These plates are anatomically designed, requiring little to no bending during the procedure. Start by temporarily fixing the plate at both ends, proximally and distally. This can be done with K-wires through the plate's small holes or with a plate positioning pin. There are 2 options to insert screws into the distal part of the plate. The first involves using the locking drill sleeve. Attach the drill sleeves to the distal part of the plate, drill to the needed depth with the corresponding drill bit, and insert the right-sized 4.0 mm locking screws using the screwdriver shaft. While power equipment can be used for insertion, the final tightening should be done manually with the torque limit handle. After all the screws in the distal part are in place, insert screws into the shaft part of the plate. Repeat these steps, drilling, depth measuring, and screw insertion, for the other screw holes. If needed, apply pressure by inserting a 4.5 mm cortical screw into the proximal DCP hole. Drill to the required depth with a pi 3.2 mm drill bit. Measure the depth and insert a 4.5 mm cortical screw into the plate. Finish by inserting the remaining 5.0 mm locking screws into the plate, following the same procedure.